During this scenario, please reflect on your own personal preparedness for serious illness decision-making. What if this happened to you or one of your loved ones?
Hello, I'm Dr. Hyland. I'm sorry to be the one to tell you this, but your father has collapsed at a store and was brought to our hospital unconscious. I understand you're the next of kin. Could you please come to the hospital immediately?
I want to thank you and your sister for coming in to see your father. Please go into the room, and the doctor will be with you shortly.
Your father was found unconscious at a store this afternoon. Apparently he had collapsed and fallen to the ground. In doing so, he banged his head really hard. His vital signs are stable at the moment. We don't have an explanation for why he collapsed, but we are more concerned with his head injury right now. He's booked for a CT scan of his head, and we'll discuss with you the findings and the next steps when we have the results. How are you folks coping with all of this?
I never thought something like this would happen.
I'm sorry for what you're going through. This must be a difficult time for your family. We have the results of the CT scan, and I'm afraid it doesn't look good. The scan shows significant brain damage. We are trying medical therapies to relieve the swelling in his brain, but they have not worked yet. Your father will need urgent surgery to decompress the swelling in his brain if he's going to have a hope of a recovery. This involves making a hole in the skull, draining the blood, and possibly removing injured brain tissue. We'll need your consent to proceed with the procedure.
If we go ahead with the surgery, what are his chances of recovery, and what kind of shape will he be in?
I'm afraid it doesn't look good. I can't be certain, but most people who present with this severity of brain injury don't fully recover. With the surgery, he has a chance of surviving, but it will be a long road ahead, waiting for the brain swelling to go down, and before we can fully assess what kind of function he will have. I'm worried that he will never be the same person that you knew before he was injured.
And what happens if we don't go ahead with the surgery?
Your dad will most likely die due to the brain swelling. Did your dad ever talk to you about his wishes for medical care if he were to get seriously ill?
No, that's not something we ever talked about. Wait, I think when we met with the lawyer, there was some language in that document that specified his wishes when he was dying, but I don't know. I don't know where that document is.
No matter, that document likely won't help. I don't know for sure he is dying. There still is a probability that your dad could recover. But the issue is, what kind of shape will he be in the future? You will have to help us guess what you think your father would have wanted. So what do you think your father would have wanted us to do, given the information I've presented with you, that if we proceed with the urgent surgery, he may survive, but with a possibility of a significant limitation to his functions or his ability to live independently.
I don't know what to do. What do you think we should do? Do you think Dad would want the surgery?